Let's review what you've learned about infant CPR. First, make sure the scene is safe. Check to see if the infant is responsive. Tap the infant on the foot and shout his or her name. Shout for help and shout loud. If someone arrives, have that person phone 911 and get an AED. If no one arrives, phone 911 on a nearby phone. Check for breathing. Scan the infant's upper body for 5 to 10 seconds. If there is no sign of breathing or the infant is only gasping, begin compressions. Make sure the infant is on a firm, flat surface. Move clothing out of the way. Put 2 fingers of one hand in the center of the chest. Push hard and push fast. Push straight down in the center of the chest at least 1/3 the depth of the chest, which is about 1.5 inches. Push at a rate of 100 to 120 compressions per minute. After each compression, let the chest come back to its normal position. After 30 compressions, quickly give 2 breaths. Do 5 sets of 30 compressions and 2 breaths. Remember to give the 2 breaths in less than 10 seconds to minimize interruptions in the compressions. If no one has come to help and you don't have a phone nearby, after 5 sets of compressions and breaths, bring the infant with you to phone 911 and get an AED if available. Use the AED immediately. You'll have a chance to practice in a moment. For now, just watch. Make sure the scene is safe. Tap the infant on the foot and shout to see if he or she is responsive. Shout for help. Tell whoever comes to phone 911 and get an AED. Check for breathing. Scan the infant's upper body to see if it rises and falls. Do this for at least 5 seconds, but no more than 10 seconds. If the infant is not breathing normally or is only gasping, begin compressions. Move clothing out of the way. Put 2 fingers on the center of the chest, just below the nipple line. Do 1 set of 30 compressions. Push hard, making sure the chest moves down at least 1/3 the depth of the chest, about 1.5 inches. Push fast, at a rate of 100 to 120 compressions per minute. After each compression, let the chest come back to its normal position. When you finish doing 30 compressions, give 2 breaths. Blow for 1 second for each breath. As you give each breath, look down at the infant's chest to see it rise. Do 5 sets of 30 compressions and 2 breaths. Remember to give the 2 breaths in less than 10 seconds to minimize interruptions in the compressions. For more information on how to use an AED on an infant, please refer to the Child AED module.